Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder, looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. We're looking down the front of the shoulder initially here. It's a little bit tight. We were able to get full motion. There's a little bit of a frozen shoulder, but we were able to get pretty good motion just with a very gentle manipulation. This is the labrum here. And then as we pull up here, we can see the middle glenohumeral ligament is this ligament right in front of the subscap. So in terms of anatomy, this is the leading edge of the subscapularis tendon, which is one of the rotator cuff tendons in the front of the shoulder. This is the middle glenohumeral ligament right here. This probe is obviously very small. Things are magnified 30 or 40 times on the screen. And so when we look at this probe, and we look at this middle glenohumeral ligament, we can get a sense of, now this is a little bit thicker than normal, but we can get a sense of how thin it really is. And we can also get a sense of how it's intra-articular, it's inside the joint. Okay, you can see it's deep to the subscap and inside the joint. It really blends into the joint capsule down below. And the interglenohumeral ligament is not even a well-defined band because it's a little bit tight there. So we're going to probably even do a little bit of a capsular release in just a minute. Looking up at this rotator cuff tear, right here, we're going to place a marker stitch through that in just a little bit, but first we're going to put the camera in the front and have a look from the front to the back. Just shaving right on the bone where the tendon's pulled away from the bone, you can see the tear right there. So we're going to stop there, and like I mentioned, I'm going to put the camera in the front here in just a minute and have a look towards the back. Looking towards the back, we've done a pretty significant release. We've got this chondral injury there that we debrided. See that there? See the extent of the release here. Taking it all the way around to the front of the shoulder. Okay. So now we're going to get to work on the rotator cuff. I'll show you some more in a minute. We're going to think through the tear. We're going to go ahead and pass a marker stitch through. So here's the marker stitch. You can see how the tendon's damaged here. We're going to pull it out and then we'll get to work on fixing the tear here in just a minute. Okay, as we just exposed the bone, you can see the little tear here. In terms of tears, this is something that's going to be very manageable for us. We're going to get this fixed for you, probably just with one anchor. We'll take a spinal needle here, check our angle, and try and focus a little bit here. So that looks like a pretty good angle. We'll make a little nick in the skin here. There's the articular margin. We don't want to put it there. We want to come back about 5 or 6 millimeters and place it about here. Go ahead. Easy, slowly. And once it's down all the way in the bone, we can unload the inserter. And then we'll just back out the inserter and the guide. And that leaves us these 3 sutures to work with. And so now it's seated, it's very solid. And we're going to go ahead and work on getting these sutures one at a time and passing them through the tendon. So the first step is to reach in from the left side of the screen here. Pull tight on the sutures. I'm going to take this blue suture here to work with first. Needle coming underneath, we'll feed that black wire. It's called the super shuttle. And we'll retrieve it right there. Okay, so we're all done here. Those are the little holes we make in the bone to release some of the bone marrow elements. But the actual repair is right in front of us here. I'm going to push in there so you can see some of the sutures. And so there we are, fully repaired. So I'm happy with the way that looks. You see another suture there, and then the final suture's in the back. Right there. Okay? So we've got 3 sutures down. That's firmly seated to the bone. We're going to get you back to the recovery room shortly. Good luck to you now.